So, Velina mai kako, I am Wanda Anae-Onishi, the Program Director of Hawaii SHIP. Candace and Stephen and I are here to talk to you about preventive services covered by Medicare. The next slide, please. Oh, I also want to mahalo Project ECHO for inviting us to share with you today. And Hawaii SHIP stands for, as Summer said, State Health Insurance Assistance Program. We are federally funded by the Administration for Community Living, and our sole purpose is just to help people understand Medicare. Medicare is super confusing. We're administered by the Hawaii Department of Health, Executive Office on Aging, and the program relies heavily on our wonderful volunteers and our partners in the area agencies on aging to help families statewide with their questions on Medicare. We like to talk to employers so they can better educate their staff, and that's what we're here for. Next slide, please. So we provide free, local, unbiased Medicare information, assistance, and referrals to our partners throughout the state. Most of our counseling appointments are handled over the phone, but during open enrollment, which started this past Saturday and runs through December 7th, we are offering in-person counseling events on Oahu. We also provide free Medicare presentations like this one to the public, and you'll see us at fairs, health fairs and exhibits where we distribute Medicare publications. We inform people about Medicare and just answer simple Medicare questions. Now, if you want to request a presentation or counseling assistance, these are our phone numbers. 808-586-7299 is our Oahu helpline. Our toll-free number for the outer islands is 1-888-875-9229. And our website is hawaiiship.org. We have tons of resources on Medicare and health-related information. So Medicare is a health insurance provided by the federal government for people who are age 65 and older, under 65 with certain disabilities, and anyone with end-stage renal disease or amyotrophic lateral sclerosis. Next slide. Now, people enrolling into Medicare, they have two options. They first start off with original Medicare, which consists of Part A, hospital insurance, and that's the inpatient services, and Part B, the medical insurance, which is the outpatient services, durable medical equipment, vaccinations. Then, if a person decides that their health needs and lifestyle is best covered by original Medicare, they can add a Medigap, which is a Medicare supplement insurance policy. Medigaps cover the gaps that original Medicare doesn't cover. And then they're strongly encouraged to enroll into a Part D prescription drug coverage to cover any drugs that the Part B or Part A doesn't cover, and just be prepared for needing to take medications in the future and preventing that late enrollment penalty that we're all afraid of. So once the person signs up for Part A and Part B, they have the option to sign up for Part C, which is a Medicare Advantage plan. Most Part C plans have prescription drug coverage built in, and the Medigap, Part D, and Medicare Advantage plans are all covered by private health insurance companies. Next slide, please. So you're all in the medical field, so this is going to come as no surprise to you about the leading causes of death, according to the Centers for Disease Control. In the US, they are heart disease, cancer, COVID-19, stroke, chronic lower respiratory disease, Alzheimer's disease, and diabetes. And that's why we like to promote these preventive services, which may help prevent illnesses, disease, and other health problems. Or they can detect the illness at an early stage when treatment is likely to work best. Now we're here to learn more about preventive care. And preventive care is the care one receives to prevent illness, to detect medical conditions, and to keep us healthy. Medicare Part B covers many preventive services, many at 100%, meaning there's no out-of-pocket costs for the patient. But there are some services that have a cost share, 80% Medicare, 20% patient, and May and Stephen will indicate which services these are. So if someone meets the eligibility requirements and guidelines for a preventive service, then they must be allowed to receive this particular service. And the first service that everyone who enrolls into Medicare Part B is eligible for is the Welcome to Medicare visit. It maps out one's health needs. It's a time to create a preventive service plan or checklist to keep everyone healthy. The visit consists of screenings and conversation with the doctor to create that preventive health care plan. And it's a one-time initial examination covered by Part B within the first 12 months that someone enrolls into the Part B. The Welcome to Medicare visit includes a review of the medical, social history, and depression and mental health of the patient. It includes a review of the ability of this patient to function safely in the home and community. It's a time when the height, weight, blood pressure, body mass index, and vision are checked, and any education or counseling and referrals. This happens at this visit by the doctor to the patient to talk about any risk factors and about the preventive service itself. So now I'm going to turn it over to Stephen, who will go more in depth about preventive services.
Thanks, Wanda. So the next service that we're going to cover is the annual wellness visit. I like to see the wellness visit as really a follow-up to the Welcome to Medicare visit that Wanda just told you about. This visit is supposed to take place after more than 12 months with Part B. And one of the things that the Medicare New Handbook emphasizes is that this is not just the physical. And so it does include a health risk assessment. There can be a depression screening as a part of it. It does review the patient's medical and family history, reviews the list of their current providers, can set up the schedule for screenings, a checklist of services needed over the as long as 5 to 10 years in advance. A check of height, weight, blood pressure, body mass index, and screen can also include a screening for cognitive impairment and functional ability and the level of safety. And Wanda had explained that many of these services have no co-payment required on the part of the beneficiary. So original Medicare and Medicare Advantage fully cover the annual wellness visit. All right, next slide. Another preventive service that Medicare covers is depression screening. And the benefit is 1 depression screening per year. You can see the screening instrument on the right side, which many of you may be familiar with already. It is covered when it is performed by the beneficiary's primary care provider. And again, there is no copayment. It's fully covered by original Medicare. All right. A very important preventive service, flu and COVID shots. And Part B covers the annual flu shot. It also provides coverage for the various COVID-19 vaccinations at no cost. This service has become particularly important through the pandemic, and even as we emerge from the pandemic, I think everybody's very well aware of the fact that for the past 2 years, flu has been severely depressed because of all of the preventive measures the population has been taking with regard to the wearing of masks and washing of hands. But the expectation is that this coming flu season is likely to be more severe. So we would really want to emphasize the importance of everyone getting their flu shots. Next slide. Also covered are pneumococcal shots. Part B provides coverage for the 2 separate pneumonia vaccines. And there usually is an interval of, I think, a year between the first and the second vaccination. But again, these shots are fully covered at 100%. There's no copayment that's required. All right, next slide. Going ahead to glaucoma testing. Glaucoma testing is covered by Part B. This is a little different because it's only covered annually if you are considered to be a high risk. And so the high risk criteria include a family history of glaucoma, or having diabetes, or being African American and over the age of 50, or Hispanic and over the age of 65, because those populations are more vulnerable to glaucoma. Also, different about this service is that it's not covered by original Medicare at 100%. It's covered at 80%, so that means there would be a 20% coinsurance amount, and the coverage under Medicare Advantage would vary depending on the plan that the beneficiary is carrying. Diabetes screenings. Diabetes screenings are covered, or 2 screenings are covered each year, and you can see the risk factors that are listed below, and this also is a very important service. Fortunately, the screenings are covered at 100% by original Medicare, and probably also by the Medicare Advantage plans. But I think everyone is well aware of the prevalence of diabetes, particularly in our Hawaii population among our seniors. So it's important that these screenings be done. Mammography. In the absence of any symptoms or prior history of breast cancer, Medicare Part B covers the mammograms, a baseline mammogram for women between the ages of 35 and 39, and then an annual screening mammogram beyond for 40 and above. And this is covered at 100% under original Medicare. I would dare to say that the same would be true for Medicare Advantage. One thing, before we leave the subject of mammograms, one interesting thing about mammograms is that if there is a finding, then the mammograms become diagnostic, then the coverage drops under original Medicare, drops to the normal 80%. So there would be a 20% coinsurance amount. One interesting development that we've noted for Medicare Advantage plans is that we have started to see a number of the Medicare Advantage plans provide 100% coverage for diagnostic mammographies also. So even if there's a finding and follow-up imaging is required or more frequently, then those particular Advantage plans would provide 100% coverage, but it depends on the Advantage plan. Next slide. And so bone mass or bone density screening. This is covered under Part B every 2 years for patients who are at risk for osteoporosis. If they are referred by their provider, the high-risk criteria are shown on the slide for estrogen-deficient women who are at risk for osteoporosis. If they have vertebral abnormalities that show up on an X-ray, or are receiving daily steroid treatments for more than 3 months, because that can lead to bone loss, have hyperparathyroidism, or are undergoing osteoporosis drug therapy. These tests are covered at 100% with no copayment required from the beneficiary again. And
Okay, and then I think I can
go-
present, and then
Okay.
maybe Wanda, if you want to jump in, or Stephen, you
Okay.
can add to it. So lung cancer is the leading cause of cancer deaths in America, and screenings are used to detect lung cancer early on when it's more likely to be curable. If lung cancer is actually caught before it spreads, the likelihood of surviving is 5 years more than and it improves to 60% your survival rate. So screening early on is very important. So we can see here the Medicare Part B covers an annual lung screening and the low dose computed tomography scan if you are between the ages of 50 and 77, currently smoke or have quit smoking in the past 15 years, smoked or have smoked an average of 1 pack per day for at least 30 years, have no symptoms or signs of lung cancer, or if you receive the screening and LDCT scan at a Medicare-approved radiology facility. Before your first screening and LDCT scan, you must have a visit with your PCP to discuss the benefits and the risk of the scan. And it's covered at 100% as well. Okay, so the cardiovascular disease screenings.
Candace,
Oh, hi, May.
I finally got on. Do you
Okay,
want to continue?
yes, you
Okay,
can take it from here.
thank you. I'm
Okay.
sorry about the problems I had with my Zoom service.
No problem.
First of all, Medicare Part B conducts blood tests once in every 5 years when ordered by the doctor, even without having signs or risk factors to qualify. Tests for cholesterol will reveal lipid and triglyceride levels, which may detect conditions leading to heart attacks and strokes. Original will cover 100% of the tests when received from a participating provider, while Medicare Advantage are required to cover the deductibles, co-payments, and co-insurance when seeing an in-network provider and meeting Medicare eligibility. Next slide, please. Okay, in 2022, there were an estimated 940 individuals diagnosed with prostate cancer. And we know that this is one of the top 5 deadliest cancers in the United States. Part B will cover an annual screening for men over 50 years old, and there are 2 types, the DRE or digital rectal exam and the PSA prostate-specific antigen test. For the DRE, after meeting the Part B deductible in original Medicare, the beneficiary will pay 20% of the Medicare approved amount in a hospital outpatient setting, in addition to paying a hospital visit co-payment. For the PSA, there is no charge for the test itself from the provider accepting Medicare, but an additional payment is made to the doctors for his services. And the Advantage plans are required when seeing an in-network provider and meeting Medicare eligibility to cover all costs without deductibles, co-payments, and co-insurance. Next slide. Now we come to another part which pertains to cervical and vaginal cancer screening. And these tests can start at 21 years of age with coverage every 24 months. However, if at high risk or at childbearing age, or you've had an abnormal Pap test in the past 36 months, or they may be looking for HPV, the human papilloma virus. Medicare will cover tests every 12 months. Part B will cover the Pap smear tests and the pelvic exams to check for cancer upon recommendation by your provider. Or again, original covers 100%, okay, when receiving services from participating provider, and Advantage, Medicare Advantage, is required to cover screening for no deductibles, co-payments, co-insurance when seeing an in-network provider and meeting Medicare eligibility. Next slide. With colorectal cancer screenings, there are these different screening tests, which may start at 45 years of age with family history or genetic syndrome. Part B covers these 5 tests, each with separate eligibility requirements. First, the fecal occult blood test is once a year if 50 years of age or older. Next, the flexible sigmoidoscopy is once every 48 months if you're 50 or older, or 120 months after a previous screening if you aren't at high risk. Next, the colonoscopy is once every 120 months or 48 months after a previous flexible sigmoidoscopy with no age requirement. The barium enema is once every 48 months if you're 50 or older when your doctor uses it instead of a flexible sigmoidoscopy or colonoscopy. And finally, the multi-targeted stool DNA test is once every 3 years if you are between the ages of 50 and 85. Don't show any symptoms and may be of an average risk of developing colorectal cancer. Next slide. Now let's take a look at the colorectal cancer screening costs. Both Original and Advantage will cover 100% when receiving services from a participating or in-network provider. The barium enema, liquid taken orally, are covered at 80% by Original, and the Advantage plans should be contacted for their costs. Now, if a new or existing problem is identified during the screening, the additional care is considered diagnostic, and Medicare may bill you for this care. Next slide, please. There are 4 helpful resources listed here and others that we may also consider that will give information and guidelines about these screening tests covered by Medicare Part B and the Medicare Advantage plans. I have found quick answers to my questions for beneficiaries by going to Medicare Interactive, as well as the other online resources. And during the question and answer period, we would like to hear from you about the reliable resources that you have used in your network community. Next slide, please.
May, I'm going to stop the screen share, and I'm going to pull up some of the resources so that they can see some of the links and what it leads to.
Sure. Okay.
So I found some on Medicare.gov and the Medicare Interactive. And I can also send this to Summer, who can send it to the members today. This is a helpful guide for beneficiaries if they wanted to have a checklist of all of the preventive screenings and just to make sure that they're up to date on all of the services. So there's quite a hefty list here, and they can just check it off and when they receive the service. Another one I'll pull up is a guide to Medicare preventive services. So this is an online publication, and we also have this one hard copy in the office that we can mail to beneficiaries. Basically outlines the services as well as what Medicare will cover This is an elaborated version of what the presentation was covering today. And then there's one more on Medicare.gov. And this is just a preventive screening service list. If you click on the service, it'll tell you more about what's covered. The presentation today is some of the preventive services, but not all. So there are additional preventive services. Then I'm going to go to the last slide and let me close out before we go into Q&A.
Okay, we'd like to say aloha and mahalo for your kind attention during the presentation. And we welcome you to contact SHIP at our Oahu or toll-free numbers or on our website listed on this slide. We welcome you to consider volunteering with Hawaii SHIP on any of the islands. We could certainly use your skills, talents, medical expertise in helping and educating Hawaii's kupuna and beneficiaries. Now we turn this over to Candace, who will conduct the rest of the presentation.
I hope everybody was seeing the slides, but yes, we had a few questions. One, I think Stephen tried to address in the chat. Does that mean retail flu shots are not covered? But then we weren't sure what you meant by retail flu shots.
I think that means like if you go to Long's or if you're in Costco and you get a flu shot, are they covered?
Stephen? Oh, you're muted, Stephen.
It would be covered. It doesn't matter what the setting. There would be coverage. If they file a claim with Medicare, Medicare will pay for it.
If others want to unmute or maybe chat their questions.
I thought it was very interesting. This was good. This was reminding me what I need to do. But the different choices for the different screening tests, you'll want to talk to your provider and discuss it with them. But is there, it's said high risk, or if you had a family history of something, how does Medicare assess that? Is there a prior authorization if you need to get, say, a colonoscopy versus a DNA stool sample?
Stephen, Wanda, me?
There's
Figure
no,
out
there wouldn't be a pre-authorization with original Medicare. And I'm also not aware of pre-auth requirements for any of the preventive services, even by the Medicare Advantage plans. So I would guess that Medicare just, that Medicare just leaves the criteria up to the primary care provider to just verify that the person it may satisfy the particular medical criteria, if there are medical criteria for the test.
Yeah, when we were preparing for this presentation, the Medicare New Handbook has a lot of good information about the preventive services. The Apple icon will indicate if it's a preventive service. There has been slight changes from last year in terms of like the age requirements as well as the coverage. So that's something to be aware of as the slight changes.
Yes, especially Candace, you can point out, on the colorectal cancer screening, slides, there were quite a number of changes, in the times and, the months and the years, and also, having different screening tests previous to, whatever you're going to, finally take. So, yeah, so would you be able to point out where this information in the handbook would be?
Yeah, it's actually all of the preventive services are listed on pages 30 to 54, and then there's an Apple icon next to them. If you don't have a Medicare New Handbook, it's also listed on our website that I can chat. There's a digital copy there.
What about the orange booklet? I know I have an older, issue, but is it up to date now?
What orange booklet?
The one you just showed that we do, distribute.
The
Wanda?
preventive services. The most current copy is available from our website in our resources page under Medicare.
Okay.
I'm going to chat the handbook. Is this information for all 50 states or Hawaii only? This is all 50 states.
Mhm.
What is the best way to sign up for basic Medicare if you're still employed and still covered by an employer plan? So that's a little bit different. So if you're still working and you're getting health insurance from your employer, it would really depend if the health insurance is creditable. Creditable means equal to or better than what Medicare's coverage would be. So to check if your insurance is creditable, the HR departments at your work are supposed to know. If they don't know, then calling the health insurance plan. They should have a letter saying that the insurance is creditable. If it is creditable, you have an option to delay Medicare enrollment while you're still working. And then after you retire, you're going to get a special enrollment period, which will allow you to enroll into Medicare without penalty. So it really depends on everybody's situation of where they're working, if they're going to continue to work or they're planning on retiring, and if they have restrictions from their retiree coverage. So if you have questions like that, definitely call SHIP and we can have a counselor kind of work you through that. And I believe we did a Medicare basics for this group before. So during that presentation, we would go more in depth about Medicare enrollment.
I do remember the Medicare basics, and I have a patient who's 80 years old and been working until now. And I was worried he was going to have a penalty, even though he had HMSA through his work until now. How does he avoid having a penalty since he's 80 and hasn't joined Medicare yet?
So as long as he has creditable insurance, so he would just check with either his former HR or the insurance company. And then when you enroll with Medicare through Social Security, they're the ones that are going to be telling you if you have a penalty or not. And they calculate the penalty for you. So yeah, maybe checking with either Social Security or the former HR or health insurance.
If he did have creditable coverage
Right.
through the employer, when he loses that coverage, the person has 8 months to sign up for Medicare, and as long as he enrolls within the 8-month period, there wouldn't be a late enrollment penalty for Part B. The late enrollment penalty period is somewhat shorter for Part D, the prescription drug coverage. That's 63 days, but generally speaking, if somebody is timely in signing up for, coverage after losing or dropping their employer coverage, they shouldn't have a problem with late enrollment penalties.
So what's the benefit of joining Medicare when you're 65 if you're still working?
Coordination of benefits. You're going to have multiple layers of health insurance, so you pay less out of pocket, little to nothing.
We tell or advise beneficiaries to sign up for Part A, premium free Part A, because they don't have to pay anything for it. Generally speaking, people opt not to sign up for Part B because they don't want to have to pay the monthly premiums for Part B, which is going to be secondary to, whatever their employer health coverage is.
That's why the sign up time is longer for that part, for Part D, Part B.
Part B, yeah, the 8 months versus the 63 days for Part D. We don't know why they do two different time frames.
Yeah, it doesn't make too much sense to us. That's just the way the law was passed for some reason.
And then I also chatted a link so that if you're working past 65, like that case you were mentioning, there's a scenario chart of the employer, the situation, and then what the advice you would need to know So that could be also a helpful resource.
Yeah, because there's a question, what is the best way to sign up for basic Medicare if you're still employed and still covered by the employer plan? So that would just be A, just go to Medicare and sign up for A because it's free.
Oh, Social Security, yeah. So if you have 40 quarters or 10 years of work experience paying into Social Security taxes, you can go through Social Security to sign up for A. If you're already collecting Social Security benefits by the time you turn 65, they're going to auto-enroll you. So if you don't want to be auto-enrolled, there is a form that you need to submit back to them saying you do not wish to enroll right now. So A and B enrollment is all through Social Security. Yeah.
Interesting. And then there's a question here that I kind of have too, because I've heard of different plans that have different costs and different benefits. And some of the costs to Advantage plans were zero. And I'm like, ooh, when it's time, I want that one. But Judy says, hi, I noticed that the usual plans that used to be in the Medicare book before aren't in the 2023 book. Do you know why? Don't the Medicare special needs plans in Hawaii or Medicare Advantage? Oh, don't we have the Medicare special needs plans in Hawaii or Medicare Advantage and other health plans in Hawaii?
Yes. So the plans change annually. So I think when I reviewed the Advantage plans, only one health insurance carrier dropped one of the plans. They're not going to offer it in 2023. Most of the Advantage plans actually added additional options. And we have a new health plan, Devoted Health, which is offering Medicare Advantage to Oahu only. So the standard Medicare Advantage with drug coverage is 122A through 122E in the 2023 handbook. On page 122 is the special medical savings account, the LASSO. And the special needs, the DSNPs, the dual special needs plans are on 123A to 123B. And then the standalone drug plans is 127C to 127E. And I can chat all of the page numbers and you can easily find that in the handbook.
And
And
Candace, is it possible that that person got the handbook that didn't have the tables? That's
Yeah, that could be
another
it.
possibility.
Not from SHIP though, because we
Right.
included the books, but maybe you did get a national handbook. The national ones don't have the Hawaii specific plans in the back. If that is we can send you one with the pages. If you're looking at the digital version on our website, scroll all the way to the end, and that's the pages that we were referring to.
And the fact that there are so many pages, and we're a small state, there's some states that have hundreds of pages, is why you guys are employed to help, right?
Yes, some states have many, many different plan options. And so Hawaii has a good amount, but it's still a little compared to the rest of the United States. And I see that person had the government US national handbook with no Hawaii specific pages. So we can definitely mail you a hard copy if you need that.
Another really good resource to use is to just go to Medicare.gov.
Mhm.
If you go to Medicare.gov and select the plans available in your area, you have to put in the zip code and it'll bring up the plans in this area.
One thing about, the premium free, attractive, feature, we always sit down, with our beneficiaries and then look at the chart and say, well, compare the deductible and other kinds of costs that follow, with the zero premium as well as, the ones that you must pay for. And there is a big difference in the deductibles and the other costs. So they will discover for themselves, if you sit side by side and you go through, this comparison with them. And so that's why that, back portion, that appendix is so important.
Yeah, it's interesting that oftentimes these are the folks who have the least digital readiness skills and maybe the least knowledge of the best plans to get, and yet we're requiring them to go through hundreds of pages to figure it out. And I remember trying to do this with my grandmother when I was just out of medical school, and it was crazy.
Yeah, so Hawaii SHIP provides free plan comparisons. We have specialists that just strictly work on the information that the beneficiary provides. We have forms to fill out that will include prescriptions they take, the provider's name, the pharmacies they choose to go to. And our specialists will run that comparison in that Medicare.gov plan finder tool. Send the beneficiary the top three-star rated and above plans. And then instead of going through all 20 plans available in Hawaii, they can just focus on the 3 that meet their healthcare needs.
And I'm
So
gonna
they're
chat
kind of-
the plan finder link. This is a free tool put on by Medicare that anybody can use to kind of see what plans are available. So I just chatted the link. You can view the 2023 plans versus the plans offered this year.
There's so many links, I'm even overwhelmed.
Candice, I saw you put some PDFs in there. We can't click on them.
Okay. It's gonna be, I can email you maybe the
Yeah.
PDFs and then you can send it. Okay.
Sounds good.
Do providers' offices get a copy of the book that you have at SHIP,
I don't think they do, yeah, Wanda.
but they could
I'm
request?
not aware. Yeah, they
we
can
have
request
a-
from us.
Yeah, we have a limited amount. So it depends on the quantity, but definitely if it's within reason, we can supply the books.
Yeah, if they just wanted 3 for their waiting room or something.
Oh yeah, and I think somebody's requesting 10. So if you do want handbooks mailed, can you please either direct message me the mailing address and the request, or you can go to our website and request the publication.
And your volunteers also counsel individuals on Medicare, right? That's what they do?
Yeah, so we have different roles, and Stephen and May, they are counselors, but also presenters. And so if somebody would call into the helpline, then they would be directed to one of our certified counselors for assistance.
So that's why the volunteers are so important. They get a lot of training. And then
Definitely, it's a lot of information for them to be aware of. Yeah.
We're still learning every day, you know, there's something new, like today's changes, you know, came upon so suddenly.
And so how many of those 20 programs we have in Hawaii, plans, how many change every year? I mean, do they all change different parts, like costs, or do you have to do this every year? That's my question.
Yeah, yes, we do have to do this every year. And I think it depends on like the market to be competitive. They need a membership. So as they see the need for these increased benefits, they then boost their benefits. So I think when the Medicare Advantage plans were presenting to us this year, the overall changes were increased dental benefits to be more comprehensive coverage. Vision benefits also increased for lenses and frames, as well as a lot of more wellness benefits, such as healthy meals. A lot of health plans are offering utility support, helping pay for people's utility bills, or OTC benefits.
And
Stephen, Wanda, May, do you have anything to add?
Yeah, I'm surprised that they're offering even, I guess maybe full or some part of the coverage for hearing aids, you know, which I don't believe, you know, even before. So several of the plans are, yeah. Can you point some of them out?
I think it was Humana. I know Humana was offering with their hearing company that they partner with a cap on hearing aids for like the basic devices versus the more comprehensive devices. I recently compiled a chart of the Medicare Advantage plans and their benefits compared to last year. So for example, it's organized by island and the plans and their general benefits. If it's in purple, it has changed from the previous years, the coverage. So this document can also be shared with you folks as well. It's a just overview of the changes, but Yeah, overall, the changes in general premiums for Advantage plans have gone down. More offers of $0 premium plans, but some of the benefits also have increased, such as your out-of-pocket cost for inpatient or outpatient services. So it's a give and take. Yeah.
And also too, Candace, acupuncture is
Yes.
also something
Naturopathic, acupuncture, chiropractic.
has come to Oahu for those of you, who are beneficiaries here. So yeah.
People can come to Oahu for acupuncture?
A lot of the plans offer coverage for acupuncture
Yeah.
visit. Yeah,
Okay.
it's becoming pretty common for
Mhm.
them to provide coverage for a certain number of visits annually.
Mhm.
Okay, I'm going to ask a controversial question. I read an article, I saw an article that said that Medicare Advantage plans were how to say this gently.
Are you talking about the New York Times article?
Yes.
Okay. We're aware of it.
It was kind of saying that it was a way for the insurance companies to strip Medicare, and they were doing all these things. What do you guys have thoughts on that?
Even you can.
I'm pretty familiar with the issue. Yeah, I think what the article said is that what it suggested is that it did more than suggest. It said that a number of Medicare Advantage plans have been sued for fraud by the federal government for, I'll say artificially, the federal government's started to make risk adjustment for the payments that they provide to the Medicare Advantage plans. And so the Medicare Advantage plans were accused of doing that, fraudulently. And I think it appeared from the article that most of these cases are still outstanding, that they haven't been resolved yet. I can say that I think that the Advantage plans have been they have worked really hard to try and improve their risk adjustment scores. I mean, it's down to the individual patient level. So every individual beneficiary under Medicare Advantage is assigned a risk score based on their utilization of services and the diagnoses that's reported for them. And I think as providers, well understand, payment was never based on diagnosis previously. And so in general, there's probably been an underreporting of diagnosis information. I mean, providers will report diagnoses when they submit claims, but they don't necessarily, report all of the diagnoses,
Right.
because there never was a need,
Right.
to
And
do
sometimes
that.
they would count against you. Like
So
there was a time when if you put smoking cessation on your billing,
Oh.
this was like 20 years ago, but if you put smoking cessation on your billing sheet, the whole thing would be rejected
Yeah.
for some reason.
Well, because of risk adjustment, the Advantage plans now have really strong incentives to try and pull as much diagnosis information as they can. And this has led to them, requesting information and doing audits of provider records and that sort of thing. And so I think I think the gist of the story is that the federal government is saying that the Advantage plans have gone too far in this direction. That they've been digging up diagnoses that maybe don't necessarily change the treatment of the patient or haven't affected the treatment. So that's what it's all about. the interesting thing about risk adjustment is that, as I understood it when I was still working, when risk adjustment was implemented, I had understood that it was supposed to be done on a budget neutral basis. So it wasn't supposed to result, so if somebody's risk adjustment was higher, that meant that somebody else's risk adjustment payments had to be reduced.
Mhm.
But it also seems from the article that, well, in doing some reading on my own, it sounds like for some reason that didn't happen, and I don't know why that didn't happen. So the net result is that the federal government's payments to the Medicare Advantage plans have increased. Yep.
Yeah, I know my husband, as a family doctor, had a job for 5 years. He says best job of his life because it was very flexible. But he would go to Medicare Advantage patients' homes and he would do a whole history and physical.
Yeah,
And he
yeah.
would document. He wasn't their doctor. He saw them once a year in their home and he would document everything. And that was used by the Medicare Advantage plan to put that person in a risk category, I guess.
Yeah, yeah. Yeah, the risk adjustment, on the face of it, doing risk adjustment makes sense. It seems like the right thing to do because it's supposed to be somewhat predictive of that person's utilization. So if somebody has higher risk, then I would say it makes sense to allocate more resources to take care of those people. But it can be taken to an extreme, and I think that's what these suits are all about. Whether the plans have done that or not. And I think the other question, which hasn't really been resolved at all, at least I haven't seen anything or know anything, is to what extent have the Medicare Advantage plans use the risk adjustment information to try and improve the management of these patients, to proactively, seek out these patients and suggest, more services that they can use. I personally think that the Medicare Advantage plans have been doing that to some degree, but I don't know to what extent. I can't make any judgments. I don't have any opinions because I don't know what the data shows.
So that was a very recent article. So we will watch out for what comes of it.
Yeah.
Interesting.
But that issue has been around for a while. That is not a brand new issue. The Advantage plan, Congress and some academics and people in CMS have been. There have been people saying that the Advantage plans are, being that they're somehow taking advantage of the system, or they're so we'll see what happens.
Yeah, I can, I'll email a PDF of the article just in case you folks are interested. I think you have to pay to see the article. So yeah, I will send a PDF copies of the documents that you weren't able to open through the chat, as well as the chart that I showed. Any other last minute questions the group has?
Thank you, everybody, for having us. Have a great week.
Yeah.